Serious. Doctors of Reddit, what was your worst? I don't think this is important, but patient. Intercepted a young woman who was just hit by a car. Her boyfriend was standing with her freaking out. I do a basic physical exam and get a history, and make her comfortable as we wait for the ambulance to arrive. Once the ambulance arrives they ask for the same information, except this time the boyfriend mentions he was the one who was actually hit by the car and was shielding his girlfriend's body. The entire car's windshield was cracked by the impact of his back. He was just freaking out and worried about her, and was in shock and hadn't begun to feel any pain yet. Had a male in his 50s walks into trauma to have his left thigh stitched up. Not an uncommon wound in an agricultural area. Speaking to him while stitching him up, he tells me he fell off a ladder while cutting a branch and the machete sliced him on the way down. Told him I was going to write him up for an x-ray of the entire leg just in case. He kept on saying he was fine, his knee hurt a bit but logically that was from the fall. I agreed, but asked him to go to the x-ray department just in case. He reluctantly walked there and back. X-rays showed a helical fracture almost the entire length of his femur. Besides being a dangerous fracture, the femur is supposed to be the most painful bone to break and he was walking around. In the end had to show him the break to get him to sit down on a wheelchair and into the hands of orthopedics. That man's pain tolerance still impresses me. Had a patient come into the ER with some sort of spider/bug bite on her hand that had progressed to a red line running up her arm. She stated she put Benadryl cream on and it was very itchy. We continued talking and I asked if she had any allergies. Yes, Benadryl. I thought good lord WTF, and I'm sure it was reflected on my face. We washed the Benadryl cream off her arm and miraculously it stopped itching. So this is the person that makes it necessary for medication commercials to say do not take this medication if you are allergic to this medication. I had a headache, and a few hours later noticed that my irises were different sizes. I went reluctantly to the emergency room. Minutes after presenting myself I had neurologists looking at me and I was rushed to get scanned. The artery about 1.5 inches below my brain had torn. The DRS were basically just waiting for me to have a stroke. I didn't. Somehow. I have a condition that when I get a migraine, one of my pupils gets bigger than the other, but I had only heard of pupil difference being a sign of something very wrong in your brain, so the first time I saw it I panicked. Emergency radiologist here. I see plenty of people presenting with understated symptoms that turn out to be mind-blowing advanced disease. The saddest one was probably the 4-year-old boy who presented with a rigid abdomen for a few months. Was told by their pediatrician it was constipation months ago, but his parents never followed up when it didn't resolve. When I imaged his abdomen I found his entire liver was replaced with a mass consistent with hepatoblastoma. I asked the parents why they waited so long to work it up. They said they were satisfied with the diagnosis of constipation. That one left a mark on my soul. This 20s guy came into the hospital. He had a lot of conditions where he wouldn't make it past 40 and he currently had some infection. We kept giving him antibiotics which helped, but not as much as we would have liked. After about a week of being in the hospital I walk in and I'm talking to him and he tells me that he got a medically necessary circumcision on his last admission to the hospital. I ask if it's okay if I take a look to make sure it's healing okay. It was black with all kinds of infection. I'm just not sure how a 20s married man, or his wife, never thought to tell anyone about this for the past week. Did a bunion and hammer toe surgery on a lady with no allergies. New patient packet, primary care note all had no known allergies. I always ask about metal allergy anytime I plan on putting in hardware. Surgery goes great. I'm on call for the practice and receive a phone call for the group 18 hours post-op. Her nerve block had worn off and she was in excruciating pain. Give instructions on what to do. Next morning she is in my office before I even arrive. Tense pain, sweating profusely, blood pressure elevated, foot is massive. Clearly not faking it. Have to send her to hospital for intractable pain. Blood work indicates elevated eosinophils but everything else normal. No blood clot or infection. Hospitalist convinced it's complex regional pain syndrome. I rack my brain and think of WTF could be going on. I am only 5 months out of residency. My butt is puckering so hard. Since eosinophils elevated, ask if she is allergic to jewelry? Thoughtful face, yeah, my tongue swelled up when I had it pierced. I had it removed the next day. She had a freaking nickel allergy. No allergist will see her to confirm, so this is all speculation but makes sense with the hardware I used. Once the hardware is removed and exchanged for titanium, her pain resolved. There was one case in my residency of hardware allergy, 1/3000th cases I was first or second assist on. If I did not scrub into that case, I don't know if I would have figured this out so quickly. Crazy case. Now I always ask, have you ever had any reactions to jewelry? A lot of patients won't tell you about problems with jewelry and may not know they have metal allergies. While pregnant with me, my mom was wrapping up an OB appointment. The GYN had already left the room. Mom was gathering herself to leave and mentioned to the nurse her contacts were messing with her. She had spots in her vision. The nurse stopped and asked her to sit down. Brought back in the GYN, who had her stay and deliver me via emergency C-section. Without anyone knowing it, she had spontaneously developed preeclampsia and her blood pressure was rocketing sky high. She was dangerously close to having a seizure, and that would have been that if she hadn't mentioned the spots in her vision and just left as the appointment was over, or the nurse didn't listen. It's those last-minute moments with good nurses that can make all the difference. My dad was getting chemo for cancer. He had a favorite nurse at the clinic, but she wasn't on shift. When I got there to pick him up one day, he noticed her coming on duty as we were leaving and stopped to say hello. She was a warm person and took his hand in greeting. She happened to glance down and then stopped and pulled his hands together. As soon as she did that, the reason was obvious. His hands were completely different colors. She looked at him and said, "I think you have a blood clot in your left shoulder. You need to go straight down to wherever, I can't remember, was it MRI, and get that scanned. Go right now, I'll call ahead and set it up." As we were leaving the chemo room, we heard her start to berate the nurse who had been looking after Dad that afternoon for not noticing. Anyway, the clot was exactly where she said it would be. If it had dislodged, it probably would have killed him instantly. They put him on blood thinners and he was fine, well, fine from the blood clot perspective. He still had a terminal cancer diagnosis, of course. Had a guy in his 50s who had been seeing an acupuncturist for an area of numbness and weakness traveling down his legs. He'd had 2 months of acupuncture for them with no improvement, so very reluctantly booked a routine GP appointment. At that point he'd started to have issues with his urination too. As soon as I started speaking to him, it became obvious that the symptoms he presented with were consistent with spinal cord compression, an absolute medical emergency. We got him straight into hospital and imaging showed cancer, with the tumor pressing onto his spinal column. Although he started treatment and steroids that day, by then it was too late. He lost the ability to walk and died a few months later from the cancer. It was enormously sad and frustrating, as that constellation of symptoms would have raised an immediate red flag with anyone with medical training. Had he come in months earlier, maybe his prognosis would have been quite different. I had no idea what spinal cord compression was at the time, but my mother went through this. She got to the point where she could no longer walk and lost ability to control urinary and bowel movements. She was staunch in her refusal to go to the hospital until I convinced her she's in a terrible condition and her home remedies were clearly not working. She knew she had stage 4 lung cancer but wanted to try juicing to cure the cancer. After going to the hospital and speaking with the ER doctors, they said that usually you have to come in at the first sign of mobility loss, or else it was likely irreversible. It was really sad because our mother made it very clear to us that if she couldn't walk again, she did not want to leave the hospital. I think she understood the finality of her request, since she repeated it to us twice and asked if we understood. She probably stayed in the ICU for 3 or 4 days before cancer rendered her unable to wake. She would try to throw her arms up occasionally when we called out to her, but otherwise she would lie in bed with her eyes closed. I had to make the difficult decision to take her off oxygen because that was her request if she couldn't walk again, and I didn't want her to suffer anymore. R.I.P. Mom. I had to take out the remainder of this guy's teeth. He was in his 60s and told us verbally and on his health history that he didn't take any meds. So I took out his last 8 teeth, all easy extractions due to infections and periodontal disease. But I couldn't get him to stop bleeding. I asked him again if he was taking anything. I finally got the clot stabilized, but it took almost an hour and I had to consult our oral surgeon. When he saw the oral surgeon a few months later about placing implants, he told the oral surgeon he was on BP medication and blood thinners. I refused to see him anymore after that. Had to perform an extraction, took a detailed medical history. Patient said they were a diabetic and a hypertensive. Both a big contraindication in extractions due to uncontrollable bleeding. Unless they're meticulous about their taking their medicines and you stop the blood thinners 5 days prior to surgery, it's usually a bloodbath. I asked the well-educated, 50-year-old woman a number of times if she took her diabetes medicines on time and if she does at-home rapid tests to check her blood sugar. She said she takes them every day without fail and hasn't missed a day in over 2 years. She said she's super disciplined about her health and would tell me if she hadn't taken them. I sent her in for a rapid blood sugar test anyway, as a precaution, And lo and behold, her values come back as 282 milligrams. Almost twice as much as the normal value, so it wasn't even like she was just off the mark. I asked her to explain and she gives a shocked expression and insisted that she took them. I ask her to physically show me her medicines instead of listing them out, and she finally says, "Oh, I don't have it right now, I make it when I need it." Make. She drinks bitter gourd juice on time every day instead of her diabetic pills because they are too big. And she 100% believed bitter gourd juice was the only medication she needs. She's a high school teacher. While I was interning in my general surgery rotation, we received a patient for an emergent exploratory laparotomy, emergent open surgery, from the ER with severe abdominal pain. ER had done an X-ray and saw that he had bowel perforation. You can see a bubble of air that collects underneath the diaphragm on a standing X-ray. The patient history we got from ER was that the patient had felt pain onset 3 days before checking into the hospital, but decided it was nothing and attempted to self-medicate with vodka for the pain until it was too unbearable. Here's the kicker: the bowel perforation was caused by acute pancreatitis, too long to explain the how and why, which was likely due to his prior alcohol abuse. So his self-medication only worsened the state he was in. Thank you for listening to another episode of Aw Dear Reddit. If you enjoyed this video, make sure to leave a like. Also leave your thoughts in the comments section below. Have a nice day.